Deputy Séan Sherlock, please.
Thank you, Ceann Comhairle. Our hearts go out to all those who have lost their loved ones and friends throughout this pandemic. I think it's vitally important that we don't become desensitised by the sheer scale of death that we've witnessed throughout this society. Minister, I wish to focus on long-term residential facilities like nursing homes. We are very fortunate that we do live in a society where care for the elderly is still characterised by compassion and humanity, and so we express our deepest gratitude to frontline workers across the country for the work that they do hourly, daily and weekly. Minister, today I want to speak for those people who live, as I said, in nursing or care homes. I applaud your handling of this crisis, but there are some questions that we feel that need to be answered. RT reported today that, according to NEFIT, there are 1,944 laboratory confirmed cases of the virus in nursing homes, and according to that report, and I quote, that is 61% higher than the number of nursing home infections revealed by NEFIT on Monday. Ceann Comhairle, that represents an increase of 740 cases in 2 days. The number of nursing home deaths is absolutely frightening, and an increase to 740 in 2 days is an astronomical figure. What we need, Minister, is clarity and transparency and a clear communications policy about what is happening in nursing homes. We need to know who exactly is in charge of managing the crisis in nursing homes at present. Is it you, Minister? Is it the HSE? Is it NEFIT? Is it the CMO? Where exactly does the buck stop? What we need to see is a clearly communicated plan that would give certainty to residents, give certainty to families and give certainty to workers within the sector. Minister, why is the number of cases of COVID-19 in long-term care facilities increasing this far into the crisis? Can you please describe the relationship, for instance, between the stakeholders that operate within the state health sector, the aforementioned CMO, NEFIT, HSE, yourself, and the relationship between those stakeholders and the owners of the private nursing homes and their representative bodies? Because, Minister, I hope you'll disavow me of this notion or perception that I have, but I perceive that at present there's a friction between how the state sector is managing this crisis and how Nursing Home Ireland is managing their affairs, if you will. There seems to be what I perceive to be some friction in the relationship there, and I would put it to you, Minister, that now is the time to ensure the safety of older people who are residents of nursing homes. Now is the time to ensure that families know who is in charge of managing this element of the crisis. And it would be very useful, for instance, for families of those in nursing homes to have sight of records relating to the day-to-day management of the crisis as it relates to their loved ones. The very notion, Minister, that in this society, in certain circumstances, but for the compassion of individual nursing and care home staff, that relatives don't have access to information about how their loved ones have died, is just not sustainable. I'd like to know exactly what is the status today in real time of the national and regional COVID-19 infection and control teams that were announced on the 4th of April. How long will they remain in situ? How many clusters exist today in nursing homes? What are the real-time figures? And can I ask you, Minister, how you would respond to, again referring to that report by RTE today, that 102 people in nursing homes are, and they use the word, presumed to have died from the virus. What relatives who don't have access to information now about how their loved one died, what they want is clear communications. They want to ensure that they know exactly of the manner in which their loved ones have passed away. And in certain circumstances, that clarity is still not there, and they feel that they are not being properly communicated with. So I know, Minister, that you are doing your best. I really do know that. But if you can give us some further clarity about how you intend to manage that. And finally, in respect of the 18,000 tests that have been carried out in long-term residential facilities, can you tell us, please, how many more have yet to be done? And is there a sunset on that process in terms of completing that testing regime? And very finally, just in two separate issues, I'm still hearing from primary care facilities that they are still in need of PPE equipment, if you will, and they're very concerned about the shortage. In one particular instance, I'm told that they have a week's supply in store, quite a large community primary care facility. And also, Minister, and I know it's not directly in your brief, but it will be looked at via the health prism, if you will, is the resumption of childcare for working people, not only for those who are frontline workers, but across society now. Because I'm sure you'll appreciate, Minister, that where you have two people working within a family and also trying to manage childcare at present, domestically, that gives rise to challenges as well. So if we had some sight or perspective from you about when the government, or if the government plans to roll out a childcare scheme that could see more and more workers outside of certain sectors filtering back into the workplace, or at least freeing up time for people who are working within the home at present to be able to, send the kids to the creche, childminder, or wherever, so that it would at least alleviate some of the pressures that are happening on a domestic front at present.
Thanks very much. Thanks to Deputy Sherlock. Because of the shortness of time, I'll go as quickly as I can. I mean, yes, you're right. We're seeing a very significant increase in the number of infections in our nursing home setting. And one of the reasons I would imagine for that is we're actively looking for it in that setting. So we have now seen, particularly since Friday, a very, very concerted effort, starting with nursing homes where there has been a significant outbreak, testing all patients asymptomatic and all staff asymptomatic, moving then to nursing homes from when there's one case and testing everybody asymptomatic, staff and residents, and then looking at nursing homes where there's no COVID, and starting with testing all staff asymptomatically there. I know the ambition was to have this all completion within 7 to 10 days, and kind of started from the weekend. So that's the kind of timescale they're working to, and they're doing everything humanly possible to get through that as quickly as possible. In relation to the legal answer as to who's in charge, well, legislation passed by this House does define the person in charge, and every nursing home, private or otherwise, is meant to have a person in charge, generally a clinical person, often a nurse. But from my perspective, in terms of how I'm managing the crisis, yes, I'm engaging with Nursing Homes Ireland twice a week, and it's appropriate I do that as a representative body. But the engagement I'm having in terms of overseeing this is with HICWA. HICWA is the regulator. HICWA is responsible for the safety of people in facilities and for reporting when it's not. And I don't just mean that, by the way, as a stick to beat the private nursing homes. They also have an obligation, which they take very seriously, to let us know when we're not doing what we should be doing too. So HICWA have published a new regulatory assessment framework in line with the Health Act 2007 passed by this House. And they're going to start visiting nursing homes, inspecting them, public and private. And this will present as many challenges, as you know, from your own constituency for public facilities as private facilities as well. They'll also be asked to sit down with the nursing home owner or the person in charge and check that the supports that we've said should be in place are in place and to report back. So it's that sort of management structure. I have a meeting of it tonight between HICWA, the HSE, the department and myself. That is the way I intend to manage it. I'm going to run out of time, but in relation to clusters, my understanding is there's 302 clusters in long-term residential centres, 179 of them in nursing homes. Their figures given out as of last night. In relation to childcare, we'll move forward on this as soon as it's safe to do so, but I take the point that it is a very sensitive one. And I want to assure you, any views I have about how we need to reform nursing home care, and I do have views on this, I do have views that we need to change after this pandemic, certainly now is not the time for it. The time now is for everyone to muck in and do everything we possibly can, public, private, voluntary, to keep people safe.